Okay, and for my last question, I'm going to switch it up actually, and I want each of our panelists to give me one thing that you're looking forward to seeing advancements in the next year for anaplastic thyroid cancer. So I'll start with Dr. Johnson.
Yeah, so again, I think getting the diagnosis right is so critical. So I do think, as we've alluded to on this talk, just getting more centers familiar with with this tumor in order to understand the gravity of it and how important making that diagnosis is. It also, as Dr. Blumberg said, it's amazing to see things shift in your career. Next generation sequencing has absolutely exploded over the last 20 years. Remember when I started residency, people would laugh when a colleague smarter than me would say, I think 10 years from now we'll be sequencing every single tumor, and everyone laughed, and that is definitely not the case. We have learned so much by sequencing these tumors. I would be excited to see next generation sequencing have an even faster turnaround time. There are certain things that limit the speed of getting those tests, but we've already come so far in getting sequencing very quickly and getting this important diagnostic information to patients and oncologists quicker and quicker. So I think the turnaround time is only going to improve, and the information we're going to gain from molecular testing of these rare tumors and aggressive tumors is only going to improve.
Great. And how about you, Dr. Blumberg?
Yeah, I think the things that excite me are, hoping, sort of alluded to as earlier is hoping to get better neoadjuvant treatments for folks who are not BRAF mutated. I think that there's some excellent work being done in clinical trials that are up and running to assess this. And I think just with, more time, more research, like as Dr. Johnson alluded to, more sequencing, we will be able to identify more targetable mutations to get this disease under control. Um, and I think the other thing is just hopeful to get more recognition of what anaplastic thyroid cancer is and what needs to be done across the board in order to get these patients on treatment as fast as we can. And so I look forward to that just at our institution, but also nationwide to get a better understanding of what this disease is and how to treat it.
Fantastic. And Dr. Cubb, last but not least.
I don't know if this is fair to have to go last on this one. So, Dr. Blumberg may have stolen my answer a little bit, and that, I do think we're seeing, and I hope to see a lot of innovation in the or the BRAF wild type constituents. But I think another thing is as we start learning more and more, just exactly where and how immunotherapy plays a part in this. The other thing I think is also taking a step further. It was great to see in 2018 this groundbreaking drugs, right? But we're almost 10 years later. So, what are we understanding now that's a step further in terms of we know some patients can respond to that and do very well for years, but we know other patients don't. And why is that? I'm in what Dr. Johnson was saying, it's like, I believe a lot of the answer there is there in understanding the tumor, the genetic alterations, what's there in the microenvironment of each tumor that makes it more responsive to immunotherapy. Are there things that we can do to make it more responsive? Like, can we prime the immune system with a little bit of radiation? What is there? So I would say just overall, understanding how all of these pieces fit together. I think that's going to take more time than the next year, but it's what I'm looking forward to in general.
Yeah, that's great. And I'll just also add my feeling is that I think for patients watching this, anaplastic thyroid cancer is very, very rare. And the only way we can move the field together is as a community. And so we're hopeful that patients will also advocate for themselves and try to be at centers that are really dedicated towards treating this malignancy and allowing them to go on clinical trials. So that way, when we do this talk 10 years from now, we'll have a lot more exciting advances to share. So with that, I'm going to conclude. I really want to thank our phenomenal panelists for taking time and on this important topic, and thank you so much for your attention.